This is Health on the Plains, a podcast about rural communities, rural life, and the many factors influencing the health and well-being of rural Kansans. Health on the Plains is a podcast from the Kansas Health Institute, a nonprofit, nonpartisan educational organization committed to informing policy and improving health in Kansas. Through honest, nuanced conversations with leaders and doers from a variety of backgrounds, the Health on the Plains podcast offers unique insights into rural health challenges in Kansas and shines a light on the people and organizations working to make their communities healthier, more vibrant places to call home.
Welcome back to another episode of Health on the Plains. We're here in McPherson, Kansas. We're at Bluestem PACE facility, and we just wrapped up a wonderful conversation with Emilie. She's the executive director here of Bluestem PACE. It's a wonderful organization doing really innovative and awesome things to help seniors and older adults maintain their dignity and stay in their home if they would like to, by surrounding them with all sorts of different services to provide the best care they can in an individualized way. It's a great conversation, and I hope you enjoy it. Today, we are here in McPherson, Kansas, and our guest is Emilie, who is the executive director of Bluestem PACE. PACE, P-A-C-E, stands for Program of All-Inclusive Care for the Elderly. Before serving as executive director, a role you took on earlier this year, Emilie was the director of market development and intake for Bluestem PACE. In that role, you helped grow the program in a variety of ways. You spent time educating adults and caregivers and potential participants and other healthcare partners about the value of the program. And then you also got to coordinate the intake of new program participants and build those connections with participants and their families. Emilie is a well-respected leader and voice in the space of PACE programs and innovative approaches to provide care. And you even recently served on a panel for an event that KHI hosted focused on person-centered care and aging in place in rural communities. Emilie, we are so excited to be with you here today and to learn more about your work. Thanks for joining us.
Thanks for having me. I'm excited that you are here.
Awesome. So today we'll be talking a lot about Bluestem PACE program and the Bluestem PACE program that's operating right here in central Kansas. But the PACE program has a really rich history. And for a little context, the roots of PACE, or what would become PACE, go all the way back to early 1970s, on the West Coast in the Chinatown North Beach community of San Francisco. In 1971, there was a public health dentist, along with some other community leaders that saw a need for long-term care services for the families whose elders had immigrated to the community from Italy, China, and the Philippines. And over 50 years and a lot of work, a lot of support from different foundations and different leaders, and some legislative action, that initial innovative approach and desire to meet those needs grew into a really well-established program that's now in 32 states, including right here in Kansas. And here in our state, as of September of this year, there are 3 PACE organizations offer services to Kansans in 23 counties. And the state is awaiting CMS approval to expand the number of counties across the state in which PACE services are provided. So PACE is both a program that you can find across the country, but it's not everywhere. And so we're really excited to have it here in Kansas and have it here in McPherson area. And in short, PACE offers participants an alternative to traditional residential care homes and nursing home facilities by enabling them to stay in their homes. And we are going to dive into what that looks like here. But before we do that, Bluestem PACE here is part of a broader organization. And to just help folks put it in context, it's part of Bluestem Communities. Can you tell us a little bit about Bluestem Communities and this region and the communities that you serve here?
Absolutely. So Bluestem Communities has a long history of caring for seniors in your traditional sense of care homes. We currently have 2 life plan communities. So one is Kidder Bethel Village, and that's in North Newton. and then also Showalter Villa in Heston. And so about 10 years ago, Bluestem said, we really want to care for seniors kind of in the traditional sense, but also in the sense of folks are starting to want to receive care at home and really stay in place. And so Bluestem was very innovative and, in collaboration with the state, opened this PACE program about 7.5 years ago in an attempt to not only serve folks in, the traditional sense of on a campus, whether that be, independent living or assisted living or healthcare, but we want to really give folks an option to stay in their communities. And so that's where PACE came in, opening in 2016.
2016. And you've been with PACE how long?
Since we opened.
Since the beginning.
Yes.
So you've seen the growth of the program from day one.
Absolutely. It's been a fun adventure to see.
And you started to sort of get into PACE program, and at its heart, it's working to meet older adults' care needs while remaining in their home, and that's a big part of. We know generally that a lot of older adults prefer to stay in their home. They want to age in the home that they built and that they know and that they love, and there's a broader concept around that called aging in place. That's the idea that. And it can be defined as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. So the PACE program really supports that idea. But before we get into specifics of what PACE looks like here in Bluestem PACE, when you think about the rural communities here in central Kansas and the communities you serve, because you serve the region, there's multiple counties. What are some of the main challenges or the barriers that our older adults here in this region face in trying to age in place?
Absolutely. Well, I think one of the things that's, I wouldn't say newer, but the spotlight's been put on it through COVID and post-COVID is really the workforce. So if you think about a senior who goes to their community physician and they say, oh, you could really benefit from some home care, or you could benefit from some assistance with bathing or dressing. It's very challenging in rural communities to be able to find agencies and or individuals who are interested and willing and, more importantly, trained to provide that care. I think another barrier is often, when we have to leave our community to get a specific kind of care or therapy, can be transportation. So when we're not driving any longer, or maybe we're depending on a son or daughter who's working to get us to appointments, being in a small community where you don't have bus service and things like that can be a definite challenge. And then just in general, just the availability of a variety of services. There may be some services available in your community, but, having each and every service that you need can be a major challenge.
Yep, absolutely. And when we think about older adults in town like I grew up in, and is similar town to where you live in, my hometown, Ness City, and you're at Mound Ridge, just south of here. 1,500 people, 1,700 people. That size town is not going to have all of the same services that a larger city has. And if you're an older adult that has more need for different services, and then on top of that, you have challenges getting to those services, at a certain point, staying in your home and overcoming those barriers time and time again can be really difficult.
Absolutely. It can be really a daily challenge, and even one that, you and I were still driving, we're, traveling at distances, no problem. It can really be the thing that keeps you up at night, the thing that really causes a lot of concern and can, really create other issues like depression and anxiety and things like that.
And so even if we have an older adult that is finding a way to make it work, that strain and that stress can have other implications. Even just quality of life can be really challenging when you're having to overcome those all the time.
Yes, it can definitely be something that's taking away from doing the things you love and want to do.
Absolutely. So with all those challenges, we talked about the challenges and the barriers. I want to now get into Bluestem PACE, and because I really think when you hear some of those challenges, and I think about what PACE program is and what it can be, it seems perfectly suited to step in and help address some of those. So when you think about Bluestem PACE specifically, and your communities here, and the ways you serve folks. What does it look like to be a participant in Bluestem PACE? What all do you do through the program?
Absolutely. Well, I'll try to keep this to our conversation today because there's so many things that we could talk about. But in general, Bluestem PACE provides the older adults in our program the opportunity to stay at home while receiving all the services they need provided through one team and coordinated and delivered to them versus a situation where you're having to go find services and piece and part them together. So one of the phrases that often gets used for PACE is we're a one-stop shop. And I love and hate that term, but it really is fitting in that, for seniors who have a complex medical conditions, they're needing support with their activities of daily living. They may need support making sure they get their medications and or are able to take them. PACE provides an opportunity for our folks to partner with us in having those needs met. So when someone's in our program, we're providing their medical care like primary care, but we're also coordinating specialty care that they need, like if they need to see the cardiologist or another ologist. We're providing all their medications. We're providing durable medical equipment. So if someone needs a walker or a wheelchair, or maybe they need a ramp for the front of their house, those are very challenging to get in an urban setting, but even more challenging in a rural setting.
Yeah.
So additionally, folks can be very isolated in rural communities. And so we bring folks into our day center where they have the opportunity to have a meal together and some meaningful activities. Like bingo is the number one thing we do here. So that's everyone's favorite. As well as while they're here at the day center, they can have physical therapy and maybe see a dietitian to talk about why they're losing weight kind of unexpectedly. So what we do is bring all the services to one place, and then we bring our seniors to that place to receive services, and then also things in their home. So if they need assistance with cleaning or bathing or getting dressed or those kinds of things, our team's able to go out to the home and care for them as well. So we just wrap them up in care.
I will say when we walked in, I love that you mentioned the bingo and the enjoyment that folks get from that, because when we walked in, we had a chance to see some of the space we're in here, and we walked by a table and saw the bingo cards, and people were playing other card games, and I think there's an immense value in that social interaction.
Absolutely.
I would imagine in the community, and we're noticing as well that people are wearing shirts that say Bluestem PACE because they're proud to be connected with and be part of it's almost like a community that you've
Absolutely.
built and a community with the care providers as well. And that feels very different than other ways you receive care. Like, I don't wear a shirt for the hospital I go to when I need to schedule an appointment.
One of the things that is different about PACE is that, what brings an individual to PACE may be that they're having more falls, or they are needing assistance with showering, or, they're forgetting to take their meds, or maybe they can't even get to the pharmacy to get their meds. Those things bring people to PACE. I think what keeps people at PACE is the community and really the family environment. So folks don't even realize how much they need interaction and relationship with others until they get here.
Yeah.
And they are looking across the table at someone and say, they're my age too, and they're struggling with diabetes, or they're struggling with heart disease that's really, causing shortness of breath and keeping them from doing those things they wanted to do. So it's finding that commonality amongst each of us. Even though we're here for a different reason, I feel like we stay for the same reason, which is the connection and that quality care that we can give because we form relationship.
Yeah. And that relationship piece, that partnership piece is something that I hear in how you talk about it, and I see in the program. And you really seems like the PACE program is intentional, that this is a partnership between the person receiving care, the participant, between the care team, even with the family members, because you mentioned there could be a variety of ways that sort of people start to get connected with or come into the program. So could you talk about that partnership approach and what that means and how that's a really important piece of this?
Absolutely. So everyone in the PACE program is qualified based on the state of Kansas assessment, to be able to live in a long-term care facility. So, they have lots of needs. So the partnership comes in that staying at home is challenging. We have a lot of barriers to overcome together. And so when we have a participant and their family maybe who are committed to doing their work to stay safe at home, we come alongside and do our work, and it just is a perfect combination of working together to stay at home. Because doing that sometimes is more challenging than looking at, a place where you're just cared for 24/7. So
so there can be some additional challenges or unique things to think about in staying at home, and it necessitates that everyone be sort of participating together. But it sounds like for the folks that do decide to participate, there's enough benefit from that it's worth doing, even when there's maybe more investment from the whole team, that it's some bigger benefit than the alternative.
Absolutely. So I think the kind of person that PACE attracts, if you will, and there's plenty of these folks in Kansas, I consider myself one of them, is, really pick yourself up by the bootstraps, really maintain our independence. I mean, none of us want someone telling us, what to do, when to do it, how to do it. And so I think in PACE, it provides an opportunity for our participants to receive as individualized care as possible, in their home environment, in collaboration with their team. And it really takes that mindset that I'm going to pick myself up by my bootstraps to stay at home when it gets challenging, when it gets hard, maybe when our mobility changes or, we're needing more care. So that get it done, individual, independent spirit that so many Kansans have really fit perfectly with PACE, because we can work hard together to keep folks at home, where our family will come see us more readily, where our dog is, and in that place we've lived for maybe 50 or 60 years.
Yeah, absolutely. And another piece of that is when I think about allowing people to remain in, or supporting them and enabling them to age in place in the home that they built, it not only allows that individual and that family to maintain that sense of place and connection to the home they built, and their pets or their favorite room that they've made just exactly the way they want, and there's memories attached to the place, and it allows all of that. But I think about, especially in our really small communities, those older adults that have been there for years, that were the former mayor, former president of the Rotary Club, or they used to be a teacher, or they maybe still are doing some of those things, but they have such an impact on the community, and they're such a voice and a leader for the community, that allowing them to remain in their home in a lot of cases also means allowing them to remain in the community itself.
Absolutely.
When the alternative is a care provider that's in another city. So is that do you see that as part of the benefit too of a program like PACE?
Absolutely. And one of the things that we notice, or folks are sometimes concerned about, is, if I'm going to come to the PACE center, but but during the day I'm involved at my senior center, or I help babysit for Bible school, or I, am involved in some other way. We always help people know that we are not trying to just keep them at home, but also in their community. So, there are some folks that are active members of their community, some that are active in as much of a capacity as they can be, and really bringing, the wisdom and relevance and the context to their communities, and keeping that going. In our small town, there's folks that we see at all the basketball games that, graduated 55 years ago. And if we didn't see them there, we would notice their absence. Our kids would miss them being there. And I think that that's something in our culture, as we've become more digital and we've come together through technology, and also have separated a little bit. What's alive and well in small communities is the intergenerational aspect. And that's not only something that's important to us here at PACE, but in Bluestem communities, to really be remaining in our communities, providing options to be able to remain engaged as possible.
Absolutely. We talked a little bit about think about some of our really small communities and some of the culture and some of the things that PACE can support continuing and those intergenerational connections and those relationships. And I want to sort of broaden out to thinking about PACE programs and how, so the PACE program you operate here serves several counties,
It
and
does.
you're based here in McPherson, which
Mhm.
for people from Ness, in my hometown, Ness City, probably feels like the bigger place,
Mhm.
but from a national standpoint, it's still pretty small. It's pretty rural. But you especially serve some really rural areas and smaller communities as well. And I imagine you do some work and connections with other PACE programs in bigger cities and
Mhm.
nationally. I'm curious to reflections on what you see about unique opportunities and challenges for PACE programs in our rural communities versus the more urban communities.
So, one of the ways that a rural PACE is really set apart from an urban PACE, I believe, is partnerships with other providers. Not only does a PACE program that's rural need to lean on like additional transportation providers, but we also lean on community-based physicians. We know in rural settings, we meet folks who have had the same doctor for 30, 40, 50
Yeah.
years. And really transitioning their care is challenging on multiple fronts. Willingness, number one. I can understand if I had a doctor for 50 years, I was probably not leaving them. And also just the continuity of care. To help seniors age in place, the continuity of care cannot be overstated. One small change can really throw things off. And so we have partnered with some community based physicians to be able to keep those relationships intact while also surrounding that individual with more care. And I think in a rural setting, that is very important because of those, the long-standing relationships that exist. So I think partnerships with providers help, bridge the gaps of relationship, and they also bridge the gaps of just service availability. So making sure that we have the services out to the farthest stretch, like Sterling, Kansas, or as north of Salina, or south to like the Sedgwick County line. So we really create a network of specialists, a network of hospitals that we work with if we need lab or we need imaging, or so we're not bringing everyone here to McPherson for imaging. We're partnered with our local hospitals, so we can do that. So I would say partnership is the one thing that sets urban and rural apart.
Yeah, that's really interesting, and that resonates with a lot of my experience. We had a physician in town that was served multiple generations by the time he eventually retired, and I imagine if I had a family member that was considering participating in PACE, that would be really important to maintain that relationship. But what sounds really unique and in a lot of ways innovative is it's a both and. So how do you maintain
Mhm.
the relationships and the resources and build on what's here and connect it with additional resources? And that opens up a whole new level of care that you're able to provide.
Absolutely. So if you think about a community clinic, they're going to order a new medication, they're going to maybe recommend some physical therapy, but the scope of how much we can make sure a person follows up with that is pretty limited. And so when we partner with a local physician, we're able to, make sure we get those medical records. We see they've ordered a new medication, they've ordered therapy, they've maybe ordered some, or they'd like to have somebody, consider for assistance with showering. Our team can then say, okay, and we're going to jump in and help support in that way. So, really being that safety net, not only for our participants and families, but the other providers that we work with.
Yeah, yeah, and you every time you're providing an example of what this looks like, it sounds slightly different, and I think that's a big piece of this too is it's really individualized, and
Absolutely.
one of the things that's part of the program is an individualized care plan. Can you tell me how, so someone comes in and they're eligible and they come into the program, what does it look like to develop that individualized care plan and who all is involved
Mhm.
in making that?
So I think one of the unique features about PACE is that it is an interdisciplinary care plan. So when folks come into our PACE program, they are assessed by two handfuls of people. So they have an assessment with our physician, with a clinic nurse, with a nurse in their home, with a social worker, with our transportation folks, just to meet with them and see what that's going to look like. They have assessments with our PT and our OT, our recreational therapist, and our dietitian.
Wow.
So this whole group of individuals meets and interacts with our participants and their family and really gleans what, from my perspective as a PT or an OT or a dietitian, what can I bring to the table to help support this individual? So then our interdisciplinary team, which is what that group of individuals is referred to, they come together and say, what do we need to do to help this individual be successful at home based on our own viewpoint, get that all on paper, make sure that's in harmony together. And then we meet with the family to say, does this sound right? Does this kind of reflect what we talked about? And this whole interdisciplinary plan is based on their goals and objectives. So when they come to see us here at PACE, we're going to say, Mr. Jones, what is your goal? What's really important to you? Because for us as medical professionals, what might be important to us and what might be important to Mr. Jones are oftentimes two different things. So we want to marry those together and make sure that we are truly meeting his needs, and then we go on to the next. So the blessing of PACE is that whatever our participants' needs are specifically, we can meet them there, but we can also grow as their needs change. And so we're constantly assessing, what are the needs? How are we serving them? Are we meeting their needs? And it's a collaborative living process. It's not a defined document. It's really an assessment that continues throughout their lifespan here at PACE.
And I imagine if I were on my own working with a family member, trying to replicate pulling together all that expertise on my own, that's 10, 20 different appointments that might be traveling all over, and you're bringing that all together, all under one roof, or the one-stop shop thing.
Yes.
And I just imagine that is a burden that's taken off of a family that maybe before that was trying to navigate those things on their own.
Correct. We have, caregivers that will reach out and say, I'm almost out of vacation for this year. I've taken off so much time, or, the doctors made these recommendations, but I'm having struggles piecing it together. And so when folks come to PACE, it is, again, it's that collaboration and the support, not only of the participant, but their family. My in-laws happen to be in this program, and as much as I know about PACE and have been working with seniors for 7 years, to have the support of the team to say, is what I'm seeing about my mother-in-law, is that concerning just to me, a layman, or is that concerning to the team, and what can we do to support?
So we talked about the quality of life improvements it can bring, and when you think about as a family member of someone, I imagine that it can also provide some benefit to that person that was being the caregiver, or even if they weren't a caregiver, just as the neighbor, the family member, the loved one, just knowing that there are more people that are behind you or with you to help make sure that your loved one's cared for. That sounds like a really amazing benefit of the program.
Absolutely. To know if you're caring for a loved one, chances are it's your first or second time doing that. It's we don't take care of we don't have 8 grandparents typically,
Right.
But our team takes care of only seniors all day long, every day, year after year after year. And so if we combined the experience in this building, we're talking hundreds of years of experience taking care of seniors. And so it is just that little, the relief of knowing we're in this together. Our families and participants have a 24-hour on-call. They can call us anytime, and they're not talking to somebody in Kansas City or in Chicago giving them support over the phone. They're talking to our team, who they know, who's been in their homes, and it's just a really great opportunity to take care of folks in their home or age in place safely, as safe as possible, we like to say here.
Yeah, and I think when we've had these conversations and in our podcast, one common theme with rural communities is how much it means to show up in person and to be in person and to be here and be part of the community. And you made that example of it's when you call, it's not someone far away in another big city that doesn't have the context. It's someone that's been here, that's part of the community, that's been in your home. And that trust, I think, probably supports the care that you provide as well.
Absolutely. So one of the things that we see when folks are new in PACE is they may have like routine visits to the ER or like hospital readmissions. They're experiencing a lot of that. And for us who aren't medical people, if you're having a sign or symptom, you maybe could take care of it in the morning, but you're so worried about it that you end up in the ER, or maybe you really do need to be at the ER because you're not able to see your doctor often enough. The trust and the longer a person's in the PACE program, interestingly enough, the data shows that drops off. So, when we know we have that trusted person we can call on the phone, we can triage the situation, we can have a nurse go out overnight, we can go out there on Christmas Day, whatever. It really helps us stay in the home and community and out of the hospital and the ER. And as we have new and different germs flying around, it's really great to be able to only be in those environments if necessary. And so we're a good partner as well to our local ERs and our local hospitals to say, are we caring for a person with a long-term view versus just looking at the next thing?
Yeah, and the I think sometimes when we're thinking about providing care or collaborations or partnerships, it can be easy to overlook the importance of trust, but trust is like the foundation upon which a lot of really important stuff happens. And when you have that foundation of trust, you're more likely to reach out, more likely to share, this is how I'm feeling, this is what matters to me, this is what I'm dealing with. And the more vulnerable you are and the more willing you are to share that, and that the person will receive it well and it will be acted upon, that can help with set up some of those benefits. So you mentioned readmission as one of the potential benefits that you're seeing. What are some of the other things that you see coming out of as sort of successes and benefits of a PACE program? We talked about quality of life, the sort of burden that carry that can go away, but what are some of the other benefits that come with participating in it?
Absolutely. So PACE, and this Bluestem PACE specifically, is able to assist 97% of the folks in our program with aging at home through the end of life. Wow. And I think that is one of the biggest successes. When somebody enrolls in PACE and they want to live at home as long as possible, when as long as possible is through the end of life, that is the ultimate goal. When we have someone pass away at home, we are all celebrating that was able to happen. Other things we are seeing, our therapy in PACE is done a lot differently than in traditional Medicare, where you are seen for a certain amount of visits after a certain event that happens. We're able to do our therapy, PT and OT, on a much more ongoing basis. Our payment structure is set up so that we can, we don't receive reimbursements for individual events. We are a capitated payment or a flat rate payment structure. So one of the things that we see is that our individuals are able to receive and participate in therapy and then also supervise exercise for a lot longer. So we're able to, increase mobility. We may have somebody come in a wheelchair and, in a appropriate amount of time, we're working with them on walking or maybe walking with an assistive device. So we're not just maintaining a baseline, but we're helping individuals become more independent than when they came to us. And so we're also seeing, hospital readmissions are being very, very low. Also ER visits being very, very low, but also really taking a look at just single events. We had an individual enroll in our program who, had been in the ER about 4 times the previous month to her enrollment. And that had been happening every month for almost a year. She'd had, about 40 ER visits. And I know that sounds to you and I like a lot, but she enrolled in our program and was here almost 5 years before passing away and had 2 ER visits. So, when you just have access to that care, we're very preventative and anticipatory. So we're trying to treat situations when they are minute and small so that we can prevent some of the, infections and falls and things like that happen when we don't get preventative care.
Absolutely. Wow. That what a great example of some of the successes. And uh, there's, I imagine some of that it is you're able to, if you're in the home, you're having so many frequent conversations, you really have ability to be eyes and ears and see and identify and prevent things that you don't have if it's more the traditional, here's our care facility, you come in whenever you want to. And sometimes it's later than we'd want to see you, and then we provide that treatment. And it's just a different approach than what we see in a lot of other care that's provided.
Absolutely. And that matters so much for individuals in staying in the community. We can identify a urinary tract infection with just a few small things. And typically they're not identified until someone's in the ER feeling really horrible, and then they're going to be in the hospital a few nights. So we can identify that early, keep them at home, keep them comfortable, and really, keep folks as comfortable as possible. You don't want something to get out of hand and end up in the ER. You're usually miserable by the time you get there.
Yeah, and that's an amazing benefit for that participant and their family. When we think about our healthcare system and the other healthcare providers, especially in rural communities, uh, if the ER is responding to something that could have been prevented, it is not able to respond in the same way to something else that maybe couldn't have been prevented.
Correct.
And I one of my parents is an EMT, head of EMS, and if the ambulance is over here, it can't be over there. And if we can prevent the things that can be prevented and save those resources for when it really is that emergency, then that's a benefit to the entire healthcare
Absolutely.
system. So I want to ask, sort of go into something that we've mentioned and talked about in a couple different ways, and it makes me think of a song that I really like, and an artist I really like. His name is Colter Wall. He's actually a Canadian singer, but he's from the Canadian Great Plains, and a lot of his music touches on the themes and the life we have in places like McPherson and Mound Ridge and the surrounding communities. He has a song titled "Plain to See Plainsman," and in the song, it's this narrator sort of reminiscing on his home and who he is and his identity. And he's talking about his travels across the country, uh, and all the people he's met, and speaks very highly of the South and the North and the East and the West. But the hook or the chorus really shows, what he cares for at his core and who he sees himself as. And it begins with, "Let me die in the country that I love the most. I'm a plain to see plainsman." And the chorus ends with, "This plain to see plainsman is longing for home."
Mm-hmm.
And when I think about the alternative to what you enable with the PACE program, I can imagine some folks that could identify with that if they had to move to somewhere else to receive care, leave their home, leave their community that they loved and that they built up. And there's a loss that comes with that. It might be a great place that you receive care, having to move to a home or a facility, but there's still a loss of your home and your identity and all that you built. And when you think about the rural communities here, and you sort of hear that line and think about the sense of connection to what people have, how important is that dignity, that autonomy and identity, enabling people to maintain that by staying in their community, in their home?
I think those things are the most important. And one of the things that those of us who work with, those aging in rural communities need to be acutely aware of and need to be reminded of often is that, it's that same independent spirit of, being able to pick yourself up by your bootstraps, raise your family, farm for many, many years in all conditions, that we need to honor and really put at the forefront, because each of us individually, whether it's remaining at home or receiving a certain type of care, and really being able to have your voice be heard in what you want for yourself, is so, so important, and something that as I work with individuals, um, often acknowledge is maybe being overlooked. I think in the best intentions, by family, by providers, by friends, it's so important that the voice of the person receiving care is heard at whatever level they're able to make it heard. And those of us caring for seniors should be really, the advocate and facilitator of making sure that voice is heard. What does the person who is receiving care want, and what's important to them? Because in rural communities, what's important may be so different than what's important in a big city, or to even their neighbor. What we each individually feel like is important should be honored. And I want that for myself in the future. And so really just trying to be acutely aware that when we're caring for people and when we're potentially caring for people, really ensuring that their voice, is at the table and really is what matters.
Yeah, and there's something, um, you if you do that, that inherently recognizes their dignity and their autonomy, and says that what you care about matters, and we're going to prioritize that. And you gave some examples earlier that may look as relatively simple as, I love going to the high school basketball games. I have a spot that I sit in. It's on the fourth row on the right, and I want to be able to climb up those stairs and get to my seat.
Right.
And how do we, as a care team, combine the different services to maintain that ability as long as possible? But you don't get to that unless you say what matters to you.
Exactly.
No.
Exactly. We'll never know what matters unless we ask the question. And so we remind each other often, maybe we've had somebody in our program for 2 or 3 years and things are changing, and maybe we're like, goodness, it seems like, we're not communicating as well. It's like, has what matters changed? Because sometimes it does. And so it's just reminding each other, that as we're caring for a person, their needs, thoughts, preferences might change. And it's really our responsibility to make sure we are aware of that and really maintaining that and making sure that we're helping those folks meet their goal. If they want to crawl to the fourth row, we're going to make sure that we prioritize therapy, and exercise and good nutrition, and making sure we're on medication. They're on medications that aren't going to cause dizziness or things like that. So it's really that approach of surrounding a person and helping them reach their goals together.
And you talked about how in doing that, you as a care team, and you have to remind yourself to really put that front and center. And it makes me think about, and I think that I would need to do the same too if I was in that situation. And part of why I think I have to do that so intentionally is perhaps that our culture in the US more generally maybe doesn't do that with our older adults. And I'm wondering, as you've worked with families with older adults, your reflections on more broadly how we see our older adults in our communities, and maybe how that lines up with what you're trying to do with Bluestem PACE, and maybe what is missing sometimes in how we approach supporting them.
Yeah, absolutely. I think one of the things that is so important is we see at some point the role of, the parent who they've brought us into this world, provided for us, raised us up with our values and our, beliefs, and maybe even a mission in life or a calling. And we're really receiving from them wisdom and direction and just all the things. We're kind of looking to our parents, right? And then in our communities, at some point in time, there's like the tipping point of where what I perceive a lot is, and I'm meeting with a family that has a 93-year-old mother and a 68-year-old daughter, and almost the perception that that role has changed and shifted from the mother to the daughter, of saying, Mom, you need to do this, and this would be good for you. And really the challenge that exists in facilitating a conversation with mother and daughter to really acknowledge that even though some support is needed, that individual, the mother, is still has the autonomy, is the dignity is maintained, so that we're not taking more control and more independence than needed from those who have come before us, our elders in our community. So I think that translates from the family dynamic also to the community dynamic of, we have the up and coming generation, and they're going to take over and make things better. And I think there's in the making things better, there is another loss that exists of how things were and how we got to where we are. We wouldn't be able to make things better if things hadn't been made better and transitioned and established in these communities for the last 50 years, the last 100 years, the last 150 years. So there's some level of respecting how we got here and the folks who helped us achieve this before we transition to this is what's next in our communities or in our families. And so I really try to look at, when we're meeting with folks, and you can kind of feel that dynamic coming, to kind of name the elephant in the room a little bit, to say, goodness, Mom, when was it that you handed over the reins, and then just have a conversation about, what are the things you that are super important for you still to have the reins on. Maybe nobody wants help with a shower, but maybe you acknowledge it's time for help with a shower. What are the things that you've got that you don't need any help with? And just to kind of engage those folks in the conversation of like, goodness, I can still do this and I can still do that. And you know what? You still need to listen to me about this or that, and really help families and communities to say there's so much wisdom and knowledge and context and nostalgia related to this generation of individuals that I feel privileged and honored to care for. We're not those are stories that we're not going to be able to replicate, in the future. We were just yesterday hearing about one of our employees who doesn't know how to use a rotary telephone, and how out in the day center they were talking about that. And not only did they get on the rotary telephone, but then we were talking about the party lines in the country and all those kinds of things. And all of these things that will be lost someday when we're no longer talking about the party line or the rotary phone, or the fact that our kids now can text when they're 3 or 4 years old or 8 or whatever. Back in the day, they walk to school uphill both ways, and where's that lost? And so we try to, here at PACE, and then also as we work with families, to really honor that and not allow that to be lost in the process. So really holding our elders up in esteem, as opposed to kind of moving on to the next best thing.
Yeah. When we know that generally, and as we get older, as we age, there some things will become harder, and if someone's able to be eligible for the PACE program, they have a certain level of need. But it's being able to say, yes, some things are harder, and there's some loss here, but that doesn't mean that we should sort of discredit or not acknowledge and not appreciate all that you still bring to the community, all that you still bring to the family, all that wisdom that you have. And it sounds like the PACE program really, that you all have here at Bluestem, PACE really tries to center that. And it goes beyond just, we have services, healthcare services, and services that we can provide. But there's, as you said, you're sitting down, having these conversations, helping families and loved ones sort of see how this all comes together, and shift maybe how they're viewing this aging experience together. Have you seen other examples where maybe that like a before and after, where that perspective of aging, or perspective on what life looks like, shifts as a result of participating?
Yes, I think one of the definite things is the definition of safe at home. when you're caring for mom or dad or grandma, we have these ideas for ourselves about what safe at home looks like. And it's time to do something else. We're too worried, and that something else is placement outside of the home, typically. But I think as we think creatively, to speak positively of technology, we have so much technology these days that we can place in a home and that we do place in a home, to say, grandma, if staying at home is the most important thing for you, and I'm telling you, when they say, you're not here to take me somewhere, I mean, with tears in their eyes, we're not going to take you somewhere. We are going to help you as much as possible to stay here. And we can kind of educate the family to say, goodness, there's lots of technology that exists that can help grandma stay at home longer, that we might not even consider without kind of a team saying, what would you think about some cameras in the home? What would you think about some monitors on the doors? What would you think about? So I think, as we think about safety at home, we think about as safe as possible. What is the family and the participant willing to accept as safety if it helps them achieve their goal of staying at home? You're not going to take me somewhere, are you? No, we're going to help you stay here as long as possible. And there's lots of ways that we can help you really do that. So I think it's a lot of it's education of the options that exist in between staying at home, aging in place with no help, kind of Wild West style, and out of home placement. There's so many cool services and technology and help that exists in the meantime. We call it the runway here at PACE. Our runway is long. When you join PACE, we're going to give you as little of the runway as possible, because we want as much of the runway as possible for the future. There's just so much can be done. So I think it's education of what's possible with families who've never done this before. Again, they're caring for mom or dad for the very first time, or mom or dad are saying, gosh, I need help for the first time. I don't want to even tell anybody that I need help. It's because we don't know what exists to help. So it's our job, and I think the job of other senior care providers, to really educate people about what exists so they know what all the options are. PACE isn't the only option in senior care, but we are a option, and we are the best option for some folks. And so we just have to educate about the option and know and believe and trust that their families and the participant themselves or other care providers are going to help educate us about what's out there to care for Mr. Smith in the best way for him.
And that's I just have that image of you come into a person's home and their perception is it's either or. I'm either here or I'm in a offsite or out of home facility or placement, and so that either or, they fight, and there's a lot of fear and a lot of concern that they can't stay in their home, and you're able to say, no, that's not what we're trying to do. But that takes education, like you said. If that's how we're viewing that time in life and that aging process is either or, then that looks and feels very different than what the option you have with Bluestem PACE. And you mentioned something earlier about the payment plan, and payment plans and reimbursement can get really technical. But in general, the way the model is set up, it allows you to provide whatever level of service is needed. It's not sort of dependent on we provide certain number, this certain amount of hours. It's we have the payment for a person, we provide you whatever you need. We pull all that. And is that accurate? And how's that different than maybe what it would look like with a different approach, and not in that sort of payment approach?
Absolutely. So for most individuals in our program, and right now I can speak of 100% of individuals in Bluestem PACE, our service is covered 100% between Medicare and CanCare. So if a person's listening, and they're here in Kansas and they have Medicare and CanCare or Medicaid, the state has come so far. The legislature has made so many amazing improvements over the last 7 years to where PACE, the PACE program throughout Kansas, is paid for at 100%. So we are reimbursed by Medicare and Medicaid at a flat rate payment structure. which is different than a doctor's office. If you go to a doctor's office and you have a visit and you have blood work done and you also have some imaging, they are going to receive 3 reimbursements for your visit. Here at PACE, we get a monthly reimbursement, and then it's really our responsibility, and we're held accountable to make sure we're caring for a person's 100% of their medical needs. But on the payment side for the individuals, folks that are with Medicare and Medicaid have no cost for our program and really get, just 100% access to care at no cost, no premiums, no co-pays, no donut holes, none of that. So, it's just a really great option for folks saying, I want to stay where I'm at, and I have, Medicare and Medicaid, and that'll pay for it at 100%. A lot of folks come to us and say, I don't know how I would pay for PACE, and we can help educate them in the process and walk them along receiving some entitlements that maybe they haven't. Again, getting care is very challenging for someone who only has done it once in their life, but we do that often and can really help folks. And so, the state of Kansas has made some major positive movement in supporting PACE at a high level through making sure folks can access PACE at no cost here in Kansas. So
amazing, and that I just think about the complexity that often surrounds receiving care and payment and billing, and what does my insurance cover, what doesn't it cover, and just the weight that is taken off your shoulders when it's that simple for the participant and there isn't that cost attached is an amazing benefit. So you started, and I want to sort of end with broadening out. So you started to talk about what the state of Kansas has done, and you all serve 6 counties here in the region, and you have a specific service area. But I imagine in all your years of experience, you've thought about what growth of PACE could look like for the state and for other rural communities. So if you had to say or to imagine what it would take to grow PACE across the state and have something like Bluestem in other parts, what do you think it would take for us as a state or for those other communities to try and do what you all are doing here?
Yes, I think one of the most exciting things is hearing that we're looking at expanding into new service areas here. I think, the thought has been for a lot of years, the service areas we have are the most rural we can go, to make bringing folks into a centralized day center make sense. I think to be successful in PACE moving forward to the even more frontier areas, we would need to consider probably partnering with some local senior centers to provide some of the day center services, which a lot of them are being done already with the PACE program, obviously providing staff to help provide the care that we do in those places, as well as probably looking at some type of mobile units for the providers. So, when you think about, we serve McPherson, Marion, Harvey, Rice, Reno, and Saline counties. McPherson's here in the center, and so we can bring everyone in. Everybody's about 45 minutes away from the center, or less. A lot of them are less. But, in your more rural spaces and frontier spaces, it would need to be considered to probably bring our clinic, which is our provider and nurses and things like that, more out on the road, where they would visit these smaller centers on certain days and at certain times. So we would need to create more of a, we need to create more of a network that is not just ancillary services, but also our main services, which are our physicians, our therapists, and things like that. And I think, the PACE providers here in Kansas are creative enough and innovative enough, and we partner on a deep level. We have a lot of communication, meetings, collaborations. We work together on legislation. So I think the providers that exist here can really have the collaboration that it takes to take PACE to more rural spaces, and through kind of an outside the box thinking. I think that's one of the things that PACE does exceptionally well is we think outside the box. We're not limited to some of the other rules and regulations. We are highly regulated. Have no concerns about that. But we are given the really the freedom to think outside the box and do things that aren't done other places and try things, and also reinvent ourselves as the needs happen. I think the COVID-19 pandemic taught us that, is that, we were doing things one way, and within 2 days we'd flipped them completely inside out, and so if we've learned anything over the last 3 or 4 years, it's that we are a lot more agile and resilient than we think and know. And so we just need to really lean into that space as we think about growing PACE in Kansas. It is possible with the right partnerships and the right support at multiple levels.
Absolutely. And I love that I think there is a lot of innovation in our rural communities, and there's a lot of resources that are there that, as you said, we have to think creatively and build on the resources that are there and connect them with additional resources, and bring the great minds and great organizations like the one you have here to those challenges, and I think we can see a lot of growth. But I've thoroughly enjoyed hearing about Bluestem PACE. It was great to come into your space and to hear about the impact you're having on people's lives, and PACE provides a lot of care and services and specific services that mean a lot. But I think that just the overall benefit in terms of quality of life and honoring people's dignity and allowing them to stay part of their communities, I think that just means the world to the future vibrancy of the rural communities that we want to see. And I'm excited that we got to hear about what you're doing here, and I'd love to see how that can potentially grow across the state.
Thank you. It's been so great to have you all here and to share our PACE with you.
Thank you.
You just heard Health on the Plains. Look for new episodes twice per month. Follow us on social media and continue to listen to the latest episodes wherever you regularly listen to podcasts. Learn more at khi.org/podcast. Thanks for listening.